At this time, we'd like to take any questions from the floor or from the web. Anybody have any questions about the Kansas University Standing Balance Scale and the usefulness of it?
Yes, I do.
Yes.
In the clinical setting, in the case of, say, a patient who would have gone through something like a total hip replacement or partial, like bilateral one side, how would this cater to their specific need, or would it follow those basic procedures as far as reaching out those places?
Absolutely, great question. Anybody from the floor like to share or talk about your experiences? And specifically, if you're talking about like total hips, total knees. I would just share with you, when you're assessing for an individual's balance, from depending on the level of where they are from their surgery, it's going to depend if you're going to do a balance assessment at all. You may do a sitting balance, and you could still do a standing balance. You might want to use in this study here. They wanted to use people who had functioning lower extremities. So the first thing we want to do is rehab to get them to a point where they're a little bit more higher functioning. Once I can get that person that they can stand up and that they can weight shift, they can take steps, then I'm going to start looking at my balance assessments. I may not do it initially in the beginning, but that's a great question. And in this study, whenever you're doing a study, you look at the subjects, and I want to encourage you. Can you tell me your name again?
Raina.
Raina asked a great question. I want to encourage you, when you read the article, look at the subjects, because anytime you read an article, they're going to have criteria that's excluded, and then they're going to have an inclusive subjects, meaning that they want to identify who really falls in for the best for this tool. And they identify the best people are people with functioning lower extremities. So anytime you read an article, always look at your subjects, always look at the criteria base. Your criteria base is going to tell you what's inclusive and what did they exclude. That's a great question. And when we're in the clinic, we want to start thinking, when should we do a balance assessment? And which ones are more out of, if you go to the slide where it talks about the different tests, you may want to use the Tenetti for sitting balance if they have to sit down, because that's something you can still do. You can still work on their sitting balance. But when it comes to their standing ability, you know that their balance is going to be scored really low. So they don't want us to go through that and go through the motions. All right? Great question. Any others?
As a senior therapist, which one would you prefer using, the Kansas University Standing Balance Scale or the Tenetti or the Berg?
Tenetti or the Berg. I'm glad Corlin asked a great question. The Berg, let's go with the Tenetti first. The Tenetti has a two-part to that assessment. Notice this one was just a standing balance. Immediate standing, and then how we actually go in multi-directions. Well, the Tenetti also does this. It's a component of it. But the Tenetti also look at gait balance. Now, you have to consider, what is it that you really want to gain? If this person is highly functioning, when I become an athletic trainer, if I'm dealing with somebody on a higher level, if I'm working with someone who is an athlete, I may try the timed up and go test. Because you know that that person can walk fast, hit the spot, and turn around. So I can use that test. But then I got to make sure which one is more functional for the person that I'm treating. It's almost like if you have a bag of tools, you want to know which one should I pull out. Do I pull out a hammer or do I pull out a screwdriver? Well, all of them are useful tools, but you got to think about who it is that you're treating. And because we're treating depending on who we're treating, the Tenetti is great when you're dealing with individuals who have sitting balance difficulties, because it's a component of it. The standing balance is a component, but also the gait. And look at gait deviations and how far you walk away from the point of the line that you may have. Timed up and go has its benefits, but not everybody can do those. So you got to start from an inpatient level, find which tool should I go into my bag and say, this is the assessment tool. So to those therapists who are part of Ergo in our facilities that are inpatient, we want to encourage them to take a look at the Kansas University and see how effective is that tool. because it's very similar to the functional independence measures as well. And you can measure it at the point of that person coming in to the point that that person goes out.